to showcase our center and the Menatox. So it's the story of like how we try developing a pediatric specific, more pediatric focused poison information center in Sri Lanka. So the outline of my talk, I'll be first giving you an introduction and background to the work we are doing and the burden of the pediatric poisoning, and then how we work to develop a KidsToxLK or Paediatric Poison Information Center, and services, research and training that we do, and finally our future directions. So if you have not visited Sri Lanka, probably you might know that it's a small country in south of Indian Ocean, yes, south of India, which inhabits a population of 23.3 million, according to latest statistics, which children under 14 account for nearly 5 million. And with regard to acute poisoning incidents under 12-year-olds, it has an incidence estimated 6.4 per 100,000 population. Coming on to healthcare needs for Sri Lankan children, so we do see a high burden of poisoning cases nationally, of which children account for a notable proportion. And we have a national poison information center based in Colombo, which is more focused on intentional poisonings as well as more adult presentations. And there is limited pediatric focused poison information services before we set up our center, which is just 4 months old. And we see unique local poisoning patterns, and also we have a wide variation in frontline clinical expertise, because some of the hospitals, like anywhere in the world, some of the hospitals are quite resource limited, and that results in sometimes unnecessary transfers across many kilometers, leading to a lot of healthcare expenditure. And also in our communities, we see a quite high prevalence of potentially harmful practice of potentially harmful first aid practices. And also that the need for optimal use of the limited healthcare resources the country is having, and also there's a need for national surveillance as well as encouraging the research around this. And the available, I have studied the people, because there are only limited number of specialists who are interested in pediatric poisoning in Sri Lanka, and based on there are a few studies done in the past, and as you can see, we see burden. This research, if you read, then it shows the burden of pediatric poisoning in Sri Lanka, and what the patterns of the practice of first aid measures by communities, the long-term outcomes as well as risk factors. In each of these case poison centers have a role to play. And in this background, so I actually wanted to set up a poison center focused on pediatric patients in our country. And this is who we got support from initially. NIHR Right for Initiative from the University of Edinburgh. You might know some of them, Prof. Michael Edelston, Prof. James Deere, Prof. Indica. So they were the ones who actually helped us initially. And then subsequently, the members of our team got various training at international locations, at APMT, at Menatox, during the previous conferences, during the previous conferences, as well as we had specific training from the Tiger Poison Information Center in South Africa. And also, some of our colleagues had training on MyPitch data entry platform, which is quite user-friendly data entry platform, which is widely used in poison information centers before we began our journey. So with this practice and the support that we were able to set up a pediatric poison information and research center based on one of the medical faculties in Sri Lanka, where I work at the moment, which is the Faculty of Medicine, University of Kelaniya. And the center was created to provide a national level support, clinicians mainly, because we're quite resource limited at the beginning, and we won't be able to give the coverage to the public at the moment. So we at the moment are focused in giving the national level support to clinicians managing poison centers, and the center is available for 24 hours a day and 7 days per week. And this is our website. and with the support of the IT team, of the faculty, we were able to develop quite a kind of detailed platform. And we are also, I think it's hiding because of the Zumba. So we are also searchable in social media platforms, including the YouTube as well as Facebook. And so after all this work, we had to get the permission from the Ministry of Health, so we had to go and then meet with the Director General of the Health Services of the country. So we got the formal approval to start our services. So what you see here is the center specialist meeting with the Director General of the Health Services. And then in September 2025, after all this work, we were able to set up the Poison Center. So you see, I think what I talk would be more useful for somebody who is willing to start a Poison Center in their country. So I hope sometimes they will be quite useful information if you really want to start a Poison Center. So we had our inauguration in September 2025, after which we had accepted receiving calls from across the country with the vision of improving the pediatric poisoning care on a national scale. And we provide timely evidence-based poison information, and also we hope to enhance the clinical outcomes and prevention with all this work. So the core goals of KidsToxLK. So at the moment we are limited in capacity, so we are focused on providing clinical decision support. So most of the time the people who call us are either junior doctors or consultants. So a notable proportion are consultant pediatricians. And also we are also engaged in training and professional development. There is a lot to be done in our country, as well as poison surveillance, as well as research, as well as community prevention and education, which I will show you in the coming slides. So with regard to clinical decision support, this is a flyer that was shared in the Sri Lanka College of Paediatricians social media as well as website with the poison hotline that caters to all children presenting with poisoning who are under 14 years of age. That's age limit to which our children gets admitted to pediatric wards. And we work in close collaboration and partnership with the Sri Lanka College of Paediatricians as well as the Ministry of Health in Sri Lanka. And here you see our team of poison information specialists. So we are all of us are either specialists in pediatrics or emergency medicine or a medical toxicologist, because at the beginning it was really difficult to hire people without pay. So funding is a limited thing. So all these poison information specialists work voluntarily without any personal financial remuneration for the work they do. And because of this, we try to cater our services based and focusing just on the clinical management of children. So all our poison experts contribute on a voluntary basis. There's no financial remuneration at the moment, and it's driven by everybody's professional commitment to child health and improving the services, with a shared mission to improve the quality and safety of healthcare, and focused on better clinical outcomes to improve the health of children who present with poisoning. So you can see Sri Lanka, and then what you see in blue is where our center is, and then what you see in red dots, those are the places where we got the calls from. So we get a market number of calls, higher proportion of calls from around that western part of the country, to which our center is close to. But as you can see, we are trying to, within this 4-month period, we're trying to expand our services, covering, in all parts of the country. The reasons for accessing services, in nearly 95% of cases, the calls are coming following a hospitalized child, following a hospital toxicity. However, there's a minority of calls coming regarding request for advice in an out-of-hospital setting, request for information, just for information but not for case management, and sometimes to requesting information about the child's health when a mother who is breastfeeding coming with a poisoning event. And what you see in here is the 25 districts of the country. So our country has 25 districts, and we've got basically calls from 24 out of 25 countries. Pretty good coverage. With the 2 districts that are close to our center giving more calls compared to the other parts of the country. And the common types of poisons needing advice. So this pie chart shows 87.2% of the case burden we had. That excludes minorities like miscellaneous poisons and plant poisons. So as you can see, the highest number of cases were children coming with paracetamol poisonings, and also the other common agents include cleaning agents, hydrocarbons, psychiatric drugs, pesticides, cosmetic agents, as well as non-paracetamol, non-psychiatric other pharmaceutical agents. And about the impact that we have made, so we are collecting all this data, with every case that we manage over the phone. As you can see, we were able to, nearly 1/3 of cases, we were able to prevent potentially harmful first aid, hospital first aid, such as, administration of activated charcoal. Because in some of the rural hospitals, whenever the child presents with poisoning, rural hospitals, we don't have training sometimes because it is a kind of very specific area of management. You tend to administer activated charcoal. So, if they call us, we were able to give the right advice, and then in about 1/3 of the cases, we were able to prevent such potentially harmful interventions where there is no particular indication to administer. And then, you see the other ones like prevented unnecessary trances, because, maybe same everywhere. If a child comes to a rural hospital and, sometimes if the managing clinician doesn't have experience in, managing a child poison, they might transfer the child. So sometimes, you don't need to transfer that child. You can manage the local hospital if you have guidance from the poison center. So in about nearly 1/5 of cases, they were able to, they were managed in the local hospital without needing to transfer to the distant hospital, saving money to the government, transfers, the cost of transfer staff, that that were needed if they were to transfer to a regional hospital. And after 3 months, at the end of December, we were able to put out our first annual report during the first week of January this year. And we are doing work on poison surveillance as well as research. So we have a team of collaborators in our country representing different universities. So we kind of collect all the data of children presenting with acute poisoning into these individual places, and then currently in the process of forming a database of all children coming to the hospital admissions, but not necessarily. They will call the poison center, so we can kind of see, how many calls out of the total number of cases need the poison information services. And also, we do initiatives to build up capacity in research, especially toxicology research. So we conduct workshops at our university as well as in our PRISH programs. And these are our web services team who maintain our website as well as do all the promotions in the social media platforms. We were able to collaborate with other pediatric poison centers as well. So one thing is kind of, to give the local doctors in the country some kind of international exposure. So we had sessions with the New Zealand, South Africa, and Varela here, so she's from Romania, so we had sessions from her as well, and Kate. And also we were able to contribute to the global capacity building, including capacity building in poisoning, especially in APMG platforms. And training and professional development. So our center is accredited as a CPD provider under the Ministry of Health. So all our projects are accredited with CPDs. So that will encourage more doctors and healthcare professionals to participate. So what you see here is the workshop that we did in different districts. So 4 different district-based workshops, mainly aiming at rural doctors. giving them training on management of poisoning and snake bites in their settings. And this is about what we did aimed at our emergency medicine MD trainees at the postgraduate university. And we hold webinars also. We do frequent webinars, about 2-3 every month. So what you can see on the webinars, and also we, some of the interesting cases we discuss among us, discuss among the specialists, and not only discuss among us, but we make it to a webinar, and then we were able to share our webinar with a number of countries on the APMT platform a few weeks ago. And all our webinars are stored in YouTube, so which is accessible to anybody free of charge. And also we collaborate with the traditional practitioners because they may have a different perspective about herbal poisonings, medications. So we're trying to collaborate and then develop a mutual understanding so that health professionals as a group can work towards bringing down pediatric poisoning. And community prevention and education. So these are the work that we have done aiming mainly at community health workers. So we are going to rural areas and then involving training, especially the community health workers to prevent snake bites, as well as to make the local rural environment safe, as well as train or to educate the rural community on safe first aids and avoiding harmful first aids. So this is a different workshop at a different place, and then you can see they are going to the houses, and then as part of their normal routine, like they have to visit the households anyway. So they use a little time to educate the public on the prevention aspect as well. And we have published several books targeted in educating the public on preventing snake bites, and the next two you see are the ones that are translated to the two local languages, Sinhalese and Tamil. And also we have a YouTube channel, a different YouTube channel, through which we try to disseminate educational videos aimed at the public. So this language, this is published in the local language, mainly aiming the local rural communities to educate them. And we were able to go on a wider scale, like we were able to approach the wider community using the national newspapers, showcasing the work that we do. Yeah, so what I just presented is what we are doing right now. But we are just 4 months since we have started our poison center, so we see a lot of challenges ahead. So one thing is securing sustainable funding. So all our poison information specialists work voluntarily. So it is not a sustainable activity. So we need to find funding as well as recruit specialists in poison information and to make it more sustainable. And then expanding service to the public. So at the moment we are providing services only to the clinicians. Sometimes they are mostly the consultant pediatricians. So we we aim to expand our services to the public with expansion of our services, and also development of human resource capacity, strengthening coordination with the Ministry of Health Systems. We do have an adult poison information center based at the National Hospital of Sri Lanka. So the coordination and then divide and then coordinate on a single number is again is one of the activities in our list. And in future, the future, expanding public access to poison services, establishing a national pediatric poison information surveillance system, and then generating local research. We have research sometimes, they are not put into action because we don't use the research data. So that is one thing that we are thinking of, and also to show, we're doing a lot of work, but then we are not showing no impact. So we are also thinking of showing the measurable, economic gains by preventing unnecessary transfers, by preventing unnecessary mobilization of staff, manpower. So economic benefit is also something that we are aiming at in showing out to the governments and then to develop KidsToxLK as a local hub in the region of the South Asia. Thank you.